Hello, I'm Caroline Payne. I'm one of the plastic surgeons, and I've been asked to talk about lipofilling. I primarily do, or mostly do, lipofilling to the breast. So patients who come along to then want to have this particular operation is that they're thinking not to have true implants. It is actually quite difficult to fill both breasts with adequate fat if you want to then have a breast augmentation purely by lipofilling. So in my practice, most of the time, it is that patients will have lipofilling to certain areas of the breast if there is a contour or a deficit in the breast. But mostly what I find is that a patient has a mastopexy and then has lipofilling to the upper décolletage area so that they can get that upper fullness that might be present with an implant put, but they might not get it over time with the mastopexy. The other one is that you get implants that have been removed, a mastopexy to lift the breast further up, and again to get that upper fullness to have lipofilling to the top of the breast. Again, you need to be able to fill both breasts, so it does mean that you can get have to harvest quite a lot of fat. So there's only a certain body physique that you'll have to be able to do the lipofilling. So this means that you've got to get the fat from somewhere, and the preferences can be from the tummy, from the flanks, from the handles at the side, and also the inner thighs and outer thighs. The fat is pretty good quality, but again, you do need to harvest far more fat to then be able to process it to then have pure fat. So the results are that if I say harvest half a litre of fat, I then put in maybe 120, 130 mils per side, then I expect about 80% of that fat to live. It can be lifted more to the amount of fat cells that will live by using a stem cell stimulating product that basically you inject stem cells into the fat to increase its yield. To prepare for lipofilling, it's not so much. It is the fact that, you have to realise that the body has to give the fat before you can use it. So you have to be aware of being able to supply yourself with a suitable bra that's not too compressive over the top of the lipofilling, but also then to be able to compress the areas where the fat has been removed. So that's usually like these shaper pants, which are just above the knee onto the abdomen, so that basically you can compress all the areas where the fat has been taken. Lipofilling itself is not the painful part. What is the liposuction. Any liposuction disrupts the little blood vessels and nerves to the skin, and it does feel like you've had a bit of a boxing session to those areas. And this can be the swelling, bruising, numbness to the skin, and liposuction itself takes 4 to 6 months to give the true results. So there is a consequence of taking out the fat to be able to use that fat for lipofilling. And again, as I said, if you're trying to fill both breasts with a significant amount of fat, you have to harvest far more fat. Recovery, again, it's not the lipofilling that's the problem. Usually it is lipofilling with a mastopexy. That can also be removal of implants. And that, again, is not a painful operation as long as you're well supported in a bra. The areas that people do complain about, again, is the place where you take the fat from. Lipofilling is meant to be lifelong, as long as the fat stays. Of course, the fat is taken from your body, processed, and then put back into the body, so it has to live. And then there's various consequences of that. The fact is some of the fat can die, and this is called fat necrosis, and can feel little, hard, firm lumps underneath the skin that you can also see in mammograms. This is important to know because obviously that area of fat did not live and has settled just under the skin and doesn't necessarily have to be removed, but you just have to be aware that it is there. Again, the amount of fat that is put in, you usually have about 80% of the fat to live. So I think of lipofilling as contours, changing contours and increasing certain areas of the breast by a subtle amount, maybe a cup size. If it is something that you've got a normal looking breast and then you want to go up a cup size and have enough adequate fat elsewhere, then it is a process to think about breast augmentation with pure lipofilling. If you want to go up more than a cup size, which is usually above 150, maybe 200 mils per side, then you have to consider that whether a breast augmentation is suitable, especially if you haven't got that much fat to be able to harvest. So overall, it is an operation that I tend to do with other operations. So that is removal of the implants and lipofilling, or a mastopexy, removal of implants and lipofilling. So that takes usually about 3 hours and requires an overnight stay. And then recovery, again, is usually simple analgesia and suitable supportive garments. The thing is about lipofilling, if you want to do it, you can sometimes do it one after the other. So in other words, if you want to keep on going up cup sizes, it does mean that you need to have multiple sessions of lipofilling. Of course, it's a general anaesthetic, incurs more cost, and also that separate areas of fat need to be harvested, because as soon as you harvest fat from one side, it causes scarring to occur in the subcutaneous tissue, in the low tissue, and it's far more difficult to get good quality fat out. So in the end, I tend to do lipofilling only to the breast. It is for contour irregularities. Maybe it's to actually even out some wrinkling or knuckling that you have over an implant. Or I combine it with a pure mastopexy and then to the top area of the breast to give some fullness. Or that it's removal of implants to then lift the breast into a new position and then again fill the top of the breast where the implant would have given more projection. I hope this helps about lipofilling to the breast. Thank you.